Welcome back, beautiful tri-state area. You're listening to a Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in the Going Deep segment, brought to you by CO2 Lift in our Expert on the Microphone series. Today we're featuring Dr. Rohrich. He's an internationally known, highly skilled, and respected plastic surgeon with a global clinical practice at Dallas Plastic Surgery Institute in Dallas, Texas, with Newsweek naming him the best plastic surgeon in the U.S. for both rhinoplasty and facelift for 4 consecutive years. There's no doubt that he's an expert at what he does. Dr. Rohrich also serves as clinical professor of plastic surgery at the Baylor College of Medicine and is chair of the Dallas Rhinoplasty Meeting and founding chair of the Dallas Cosmetic Surgery and Medicine Meeting. Today, he's going to join me to discuss the latest in rhinoplasty and facelift techniques and how CO2 Lift is improving procedure results and speeding up the healing process. Welcoming now to the show is the amazing Dr. Rohrich. Welcome to the show, superstar.
Thanks so much. It's an honor to be here.
So excited to have you join our show. You have been honored by your peers as one of the most influential physicians and plastic surgeons in the century. Dear Lord, which is incredibly telling of your skill and dedication to your craft. So honored to have you on this show. And you are regarded as an expert specifically in both rhinoplasty and facelift procedures. Now, I would love to know what inspired you to enter this field and specialize in these procedures.
I'm board certified in plastic surgery. I've always had an interest in art and science. And of course, the most challenging procedures in all of plastic surgery are rhinoplasty and facial rejuvenation. So I really developed an interest in the science of aging and how we age and how we can restore people in a natural way, both for facial rejuvenation and for rhinoplasty. Because in this era of social media, the sign of excellent plastic surgery is something you can't detect. So that's both for rhinoplasty and for facelifts. And as you can see in social media, sometimes that doesn't always come true.
So very true what you're saying. And you're also an expert in the science of aging. And through your innovative work, you pioneered the lift and fill facelift. Now, not all faces are the same, so it only makes sense that not all facelifts should be performed the same way. So your facelift techniques are highly regarded for delivering natural results. So how do you approach tailoring this procedure to each patient's individual needs? And how does your lift and fill technique, so to speak, contribute to a more youthful and yet still very natural appearance?
Well, when you look at the science of aging, of how we age, we lose fat in our central face first, in our temple area, we get hollowing. So it's only natural that we restore it in a similar manner. So the lift and fill deep layer facelift fills the central part of the face with fat, your own fat, which is the best filler. And then you lift the deep layer. So you're lifting and filling. And everybody has to be customized because everybody's face is asymmetric. You look at anybody who's famous, you have a big eye and a small eye. So the goal is to restore and shape and symmetry and to do it in a natural way. Because after all, as plastic surgeons, we're committed to face protection, not witness protection. So we've got to make sure that we all look great, but not look weird.
I love what you just said. Now, a facelift is certainly not an easy procedure to recover from, but in fact, there are things you can do to make it easier, right? So let's bring CO2 Lift into the picture here. CO2 Lift is non-invasive, clinically proven, medical grade carbon gel that not only offers monotherapy benefits, but without a doubt can significantly improve a patient's results and comfort post procedures. Now, doctor, how do you incorporate CO2 Lift into your practice? And have you noticed measurable differences in recovery times or outcomes when patients implement it post procedure?
Absolutely. You know, the CO2 is really based in science. It's a CO2 gel that actually is based upon true science of the Bohr effect, which basically, when you put CO2 into the face and displace it, you actually get oxygenation, which is like a mini hyperbaric treatment. So it has truly been a game changer in pre-op as well as post-op facial wound healing, because so many people are now doing hyperbaric chambers, but obviously this is a shortcut to that. You can put on these masks daily for 3 to 5 days, and it's dramatic. how it enhances wound healing, diminishes bruising, and my patients even use it like before they go out on a date at night, or they go because it just soothes the face and it just brings out it hyperoxygenates the face. So it's based in science, it works well, and anything to speed up recovery is something that is truly welcomed by not only our patients, but really by all plastic surgeons.
You're such a pioneer in what you do. Thank you so much for contributing tonight to our show. Now, let's shift to rhinoplasty. You're a top rated expert in rhinoplasty, which is especially impressive considering rhinoplasty is one of the most difficult procedures in plastic surgery to achieve consistently good results, right? So, as an expert, what new technologies or techniques have you implemented in regard to rhinoplasty, and what does the process look like? I mean, how do you help your patients manage post-surgical care?
I think the biggest change in rhinoplasty has been the ability to preserve tissue, not just remove it. So it's not only preservation, but it's structural restoration of the nose and really doing it in a meticulous way. And I've developed a method that's very consistent and systematic so that people can get reproducible, great results, even though it's the most challenging procedure in all of plastic surgery. So I've taught over 15,000 plastic surgeons and otolaryngologists the art and science of rhinoplasty. So it's really been a game changer to do a very systematic approach to this very challenging procedure. And the way we've enhanced recovery is not only meticulous technique, but also enhanced recovery with the CO2 mask. And also we use light therapy as well. So the recovery is about a week or 10 days. You know, you can be in makeup in a week or 10 days, back working out in 3 to 4 weeks, but it does take about 12 months to see the final result. But many times people can be photo ready in 10 to 12 days and look great. And again, the sign of a great rhinoplasty, just like a great facelift, is that it looks natural. It doesn't look like, oh my goodness, you had a rhinoplasty. The key is looking great on your face. So every nose has to be customized to the patient's facial features. You can't just say, I'm going to pick out Angelina Jolie's nose because her nose looks great on her. It doesn't look good on somebody with a longer face or with a thicker face.
Mathematical proportions. It all comes down to the proper balance, and you have that
Right,
eye for that. You're in your own very way. You're an artist, a Picasso, if you will, and that face is extremely critical when you're
right.
evaluating, and I love that you take a very, very thorough approach to evaluation, which is critical. You don't just say, "Hey, you wanna look like this celebrity? I will give you that nose." In fact, what you just said speaks volumes that everyone has a different aesthetic. Now, I've heard many of your peers compare, and I'm gonna pivot back to what you said, CO2 lift to a hyperbaric oxygen chamber, which makes sense as both therapies utilize oxygen in their respective processes. Now, I think it goes without saying that using a non-invasive gel mask that could be actually applied in office or even at home is significantly easier than resorting to a hyperbaric oxygen chamber. So, how do you see innovations like CO2 lift mask influencing the future of post surgical care in plastic surgery?
Well, I think the CO2 mask is really one of the key game changers in decreasing recovery, enhancing outcomes, and it goes in a long way because so many of my patients come in around from around the world. So they want to get in, have the procedure, and then spend 7 days in Dallas, and then this will smooth their recovery so they can go home, put makeup on. So anything that can do that, and certainly you're right, hyperbaric oxygen is a bit more cumbersome. It's obviously more costly than a CO2 mask. And these are masks you can apply by yourself. You put it on for 45 minutes, and you just peel it off, and
Right.
it's refreshing. So it's a true game changer.
There's something so proprietary in simplicity, right? Now, aside from your accomplishments in your practice, you're also an educator serving as a clinical professor, chairing some of the most prestigious plastic surgery organizations in the country, and authoring 1,000 academic peer reviewed publications and 8 textbooks. Just wow. Why do you believe education is crucial in the field of plastic surgery for both students and practicing health professionals, especially in an era of such rapid advancements?
Well, I think you're absolutely right. There's so many rapid advancements in plastic surgery. I always tell my fellows and residents, that people I teach, that if you're doing 50% of the things that I've taught you today, you're outdated, because change is constant. Change is just part of life, and it's certainly part of medicine. The transformational things that have happened in medicine and anything in our environment today with the explosion of the information technology has been unbelievable. So you have to stay at the cutting and bleeding edge of that technology. And you do that by being part of it, by changing, by always asking why. Well, how can I do this better? And also being part of that cutting edge. Since I do cutting edge research, I do FDA trials. I am at the cutting edge of what people will see in 3 to 5 years in cosmetic surgery and in rhinoplasty. And that's a good place because I can sort out what's safe and what works and what doesn't.
That's a great place to be at, Dr. Rod. And more importantly, you are not only a trailblazer, but an innovator at the forefront of these technologies and these innovations. And I truly love that education is a huge proponent of what you do. It's absolutely critical. Now, how do you personally stay up to date on like the latest techniques and technologies like CO2 lift? What's your source?
Well, my source is, it's the world because I travel. Like this year, I traveled to 4 different continents. I gave 50 lectures. I've lectured and operated in India and all over Europe. So basically, I stay by keeping my eyes open and listening, because you see, you hear, when you listen, you actually learn more than you speak. So it is amazing the things that are happening around the world today that actually can be applied to plastic surgery, and the CO2 lift is one of them. So, and I read voraciously. I read 5 medical plastic surgery journals every month, and I'm past editor of our journal, the Plastic and Reconstructive Surgery Journal, which was the largest and most respected journal in the world. So I'm used to reading multiple articles every day. I'm a speed reader, and I'm also part of what we do is you've got to give back. So if you want to really learn at a rapid pace and you want to be able to sort out what's safe and what's not, you've got to be able to ingest a lot of knowledge and then sort out what's safe and what's not for our patients.
Wow, you are such a trailblazer and more importantly, a game changer. And I love your philosophy and your outlook on life, on education, on interaction, on really truly pioneering the next generation of plastic surgeons. I mean, truly being in all of these continents and speaking amongst all of these incredible individuals and being a KOL, that is without a doubt a huge accomplishment, and it goes with notice. It doesn't go without notice. So I want to thank you without a doubt for joining us tonight and really giving us such depth and perspective into a field that quite often there's so much misinformation surrounding. So thank you so much for your time.
It's my pleasure. Remember to be passionate, be purpose driven, and always persevere. Thank you so much.
That was our Going Deep segment brought to you by CO2 Lift, and that was Dr. Rod Rohrich, top-rated plastic surgeon, rhinoplasty, and facelift expert with a global clinical practice at Dallas Plastic Surgery Institute in Dallas, Texas. Definitely head to his website, drrohrich.com, to learn more and check him out on the gram at rod.rohrich. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.